Hi, my name is Linda Graffius, and I am a faith community nurse, and I'm also the Director of Care and Health Ministry here at Luther Memorial. Thank you, John. That was very, very nice presentation. Mine's a little more touchy subject, I think, being making choices and advanced planning for your health care. We make lots of choices during our lifetime, including things about our family, our homes, and our careers. But one of the most important choices is about making our future medical care decisions. Who makes the choices? You make the choices, and at least you should make the choices. While you are well, you should decide about the kind of care you want. Imagine this: without warning, you have a life-threatening illness. Despite the best medical treatment, your doctors believe that it is unlikely you will survive. And yes, advanced medical technology can prolong your life indefinitely. For that reason, it's important to express how you feel, to make your own decisions. Think about what kind of treatment you want. You may have already received advanced directives from your doctor. Did he help you complete them? Probably not. 80% of the people say that if seriously ill, they want to talk to their doctor about wishes for end-of-life treatment. 7% report having had this conversation with their doctor. 60% of people say that making sure their family is not burdened by tough decisions is extremely important. But 56% have not communicated their end-of-life wishes with their family. 90% of people say that talking with their loved ones about end-of-life care is important, but 27% have actually done so. Putting loved ones in the position of having to make decisions can be very difficult. Just discussing your choices now can help. The gifts that we give to our loved ones. Yes, we give and leave our children and other loved ones our love. We've handed down our faith life, and of course we leave our material things, probably too many material things. But the most important gift we can give them is the advanced planning and directives. So what is advanced care planning? It's the process of coming to understand, reflect on, discuss, and plan for a time when you cannot make your own medical decisions and are unlikely to recover from your illness or injury. Good advanced care planning improves the quality of your advanced directives. So how do you talk to your family? Sometimes it's easy, sometimes it's not. You may want to practice before you do it. You may want to write a letter or talk to a friend to reveal how you want your end-of-life decisions made. Because sometimes your family will disagree with what you have, what your choices have been, and that's okay. It's important to simply know this and to continue talking about it now, not during a medical crisis. Make a list of those who you want to talk to. When would be a good time? And where will you feel comfortable talking about this? Since you are addressing this issue when you are well, if you should become seriously ill, you will have to talk about this and maybe even make some changes to your directives. On the tables are handouts and guides. The first two are from the state of Pennsylvania. The next one is the guide from Senator Wiley's office that John mentioned. And then the last one is a pamphlet called Five Wishes. It went on too far.
It's right click.
Push the click bar.
And then
Yep, there we go. Advanced directives can be completed orally or in writing. In writing helps people accurately remember your plan and is easier to communicate to health providers and provides the possibility for it to be a legal document. The two choices are first, appoint a power of attorney for health care. The second is a document that provides a narrow set of instructions about the care at the end of life, also called a living will. It is important to educate yourself on the terminology used in advance directives. People generally know what CPR is, but do they know what intubation, medical ventilation is, or artificial nutrition, or hydration? Advanced directives also cover receiving IVs, dialysis, and even if you want antibiotics or if you don't want antibiotics, or if you want tube feedings or you don't want them. So educate yourself to these terms before you complete your documents. And the handouts do have a glossary in them that describe all those terms. When are the advanced directives used? They're used if you're unable to make your own decisions. Your advanced directives will guide decision making. Make sure your healthcare power of attorney has a copy of your advanced directives. And that's another one that's hard to decide who you want to be your healthcare power of attorney. And it's sometimes good to have a second person for that too, in case that first one doesn't want to make those choices, or they need to talk about it. Also give one to your doctor. There are also wallet cards indicating that you have an advanced directives. In the event of emergency, life-sustaining measures may be started. I had an example of that when my mom passed away. She had been sick, she respiratory arrested, she was on a ventilator, and she pulled her own tube out. She was a nurse. And she said, "Don't ever do that to me again." So 6-7 years passed, and she had massive stroke. She had only been in the nursing home for 2 weeks, and they knew that she did not want anything else done. But we didn't have advanced directives back then. And so the EMTs came in and they did everything. And I was really upset because that's not what she wanted. Well, it happened that she was on the ventilator for about a week, and we weaned her off, and she lived another week. And I thought, I'm glad I had those 2 weeks. I really wasn't ready, you know. But now with advanced directives, you know what they want, what your family loved one wants at the end of life. And if they do start treatment, it can be stopped if it's discovered that it's not what you want. The law does not require that you have an attorney to complete this. Sorry, John.
It's okay.
The choice is yours. I felt better having John help me do it. What's the next step after you've talked about it and thought about it and educated yourself? Decide who you want to talk to. Most people talk with their primary care doctor. Other choices are another nurse, a nurse practitioner, a physician's assistant, social worker, case managers, just to name a few of who you can talk to. Decide when you want to talk to them. At your next doctor's appointment, if you're going into the hospital, they'll almost always ask you if you have advanced directives. If you have a new diagnosis, it might be a time to change something. It helps your doctor and healthcare team if they know in advance that you want to talk to them. So when you go and make your next appointment and you want to talk to them about it, let them know so that they can schedule in a few more minutes. And I did read somewhere that Medicare is talking about reimbursing the doctor for doing this, for talking to their patients and getting this out in the open. Some people don't feel comfortable talking about it. They might want to write a letter to the doctor. If you have a serious illness or are very elderly, and there's an important milestone in your life, like a wedding, like your grandchild's wedding, and you're very seriously ill, talk to your doctor and say, what do I have to do to keep going so I can go to this wedding? Be sure to ask lots of questions when you're talking to them. Make sure to ask your doctor, healthcare team to document your discussions and your wishes in your records and give them a copy of your advanced directives. What additional choices and wishes are there? As I mentioned, there's the 5 Wishes program. I'm not particularly advocating this program, but I think it's really nice. It gives you another choice for making your final wishes. It also addresses your wishes for how comfortable you want to be in the end, what you want done, how you want people to treat you, and what you want your loved ones to know. There's plenty of copies there, so feel free to take one. And in that book is also, at the back of it, are the wallet cards. I do not resuscitate necklace or bracelets, can also be purchased online. And as I was talking about years ago, when I was practicing in the hospital, before the onset of advanced directives, my nurse friends and I, we were working in critical care, so we saw some pretty strong heroics being done. But we would joke that we would want to do not resuscitate bracelet or even tattooed on your chest. Because you'd be resuscitated, and no matter what, it would go on for a long time. And it really is sad and very difficult for the family. Now with the development of documenting advanced directives, it's not necessary. Our choices will be known. And I hope you take the time to complete your will and advanced directives while you are well and capable to make this important choice. Thank you.
Thank you.
Yes.
I have just a quick question, I guess. In today's age where we have our primary care physicians and you go to the hospital, you see a hospitalist. Does that primary care physician share this kind of information with the hospital?
Well,
Or are you better off having a wallet card?
I think a wallet card is really good, but with the advancement of electronic medical recording, if it's in your doctor's office record, it should show up in your hospital record. Yes.
I know, Linda, you and I have talked about this before, but I don't know if people are aware of if you have a loved one and they pass away at home and you need help and you call 911, they have to do CPR. Unless you have this living will in your hand, and most of the time during a crisis, because this happened when my mother was bad and my dad was helping me on the floor and he couldn't get up, and so I got the phone and I called and they said, "Do you know how to do CPR?" And I said, "Yes." And they said, "Well, start it." And I said, "No, that was not her wishes." So while she was in the dying process, my dad and I were with her, and then they came and they did full CPR all the way to the hospital. And sometimes I don't know if a living will is that valid unless you have it right in your purse.
Would the wallet card then help with that
But
situation?
that is, you
Okay.
cannot have an ambulance without them
You gotta
doing
tell
full
somebody that you've got
measures.
this card.
You're seeing, not to cut up, not to stop there, Joe, you're seeing the living will be incorporated into that healthcare power of attorney more and more frequently. Because then your agent will usually have that documentation with them. And especially if you're gonna be in a situation where you're already having problems, or you know that, you know, you're sick, or, you know, you wanna have that agent have that so they can produce it at any point. That way, it moves towards that, because like you said, if there's a living will, I mean, at that point, where are you gonna, who knows
Yeah,
where it is,
where
who's
is
gonna go
it? Yeah.
look, who's got the, you know, who's got the mindset
Right.
to look for it. So you do see that move away from the living will itself, but it's being incorporated, and you can see, I believe Linda has copies of it. It's being incorporated into the healthcare power of attorney. So you now name an agent and then write down your directives, and it's all encompassed in that one document.
Yes,
I don't know if this is a time or place, but please consider being an organ donor also.
yes,
And that is actually one of the things listed on the living will.
it is listed in there.
I want to back up a moment here. You said the wallet card, if you carry that wallet card that says "do not resuscitate" and is it signed, would that do for, because that same thing happened to me. When I was at the doctor with my husband in January, the doctor told us, and right in front of my husband, "Your heart is so bad, you do not want to be resuscitated." I was scared to death. I thought, what do I do?
Right.
Of course, and he says, keep him comfortable. If he falls, just keep him comfortable.
Don't call.
Well, I prayed that I would not have to make that choice, because I thought, how do you make that choice? If someone falls in front of you, sure, you're gonna call for help. Well, I didn't have to make that
Right,
choice.
you
I
didn't,
came
yeah.
home and found him on the floor, and he was gone. And I thought, thank God that I didn't have to do that.
Right.
But I did not know at that time, nor did the doctor even tell me, that if I had called 911, they would have had to resuscitate. I found that out after I called Cheryl, my best friend here, to ask her for help. So if there's something that you can have on you, like you carry in your wall, that would be fantastic.
The wallet card itself says, important notice to medical personnel. I have a 5 wishes advance directive in your signature. Please consult this document and/or my healthcare agent in an emergency. And then it lists a space where you can fill in the agent's name. And then the other part of it is my primary care physician is name, address, phone number, and my document is located at.
But that's not gonna help you if you're out in your car or something and something happens to you.
You know, the
Better than
necklace-
nothing.
The necklace or the bracelet would be the best thing
Yeah.
to have.
And they're not
And they
cheap too.
check.
Or a tattoo.
Or the
For
tattoo.
tattoo, if you get money for Mother's Day, get a tattoo.
So if you're wearing a necklace that says do not resuscitate, they have to honor that, is that
I
right?
believe so.
I don't know.
Yeah.
Legally.
Yeah, legally, I'd have to ask like a paramedic or somebody that for sure, but
That's your next
that's
assignment.
my,
That's her follow-up.
thank you very much for attending.
Thank you.
Thank you.